Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Drinking as little as 3 to 6 alcoholic beverages a week can increase breast cancer risk among women, according to research published in the Journal of the American Medical Association. Here are some health problems that have been linked with heavy drinking: liver disease, sleep disorders, and heart disease and stroke. Researchers from Brigham and Women's Hospital and Harvard Medical School followed more than 100,000 women who participated in the Nurses' Health Study from 1980 to 2008. The women were assessed for their alcohol consumption at the outset of the study and then 8 more times during the follow-up period. The investigators assessed the relationship between women's alcohol consumption and the risk of breast cancer. During the 28 years of follow-up, more than 7,500 cases of invasive breast cancer were diagnosed in the women. The more the women drank, the higher the risk of breast cancer, and this association was seen even among women who drank only 3 to 6 alcoholic beverages a week. Drinking at this moderate level was associated with 15% increased risk of breast cancer. After taking into account the total amount of alcohol the women drank, binge drinking was also associated with an increased risk for breast cancer. It appeared, however, that the total amount the women drank affected their breast cancer risk, not the frequency with which they drank. We had a chance to speak with Dr. Wendy Chen, principal investigator of this study, who offered some further insight.
There were several things that was new about our study. One of them is that we were looking at lower levels of alcohol consumption, specifically looked at women who consumed 3 to 6 glasses of wine per week, and we found a small increased risk of breast cancer at that level. We also looked at lifetime alcohol consumption to see if there were different contributions for drinking at age 18 to 40 or 40 and older, and what we found was that drinking at different times in life were all associated with breast cancer risk.
Today's research raises question about whether it may be advisable for women to quit drinking after menopause when the risk of breast cancer starts to rise. It remains unclear whether this would really reduce risk, however, in women who have been drinking all their lives. One must also take into account the fact that moderate drinking has also been shown to reduce cardiovascular risk. For Insider Medicine in Depth, I'm Dr. Susan Sharma.